Your teeth are trying to tell you something, and it could save your life. Now, I'm not exaggerating. If you've ever had a filling, root canal, or crown, you probably know what I mean. But if you have perfectly healthy teeth and gums, keep watching. Your mouth is actually a window into your overall health, reflecting what's happening inside your body from head to toe. And surprisingly, the secrets your teeth and gums hold can help you spot health problems early when they're easier to treat. This is very important because chronic diseases like diabetes, heart disease, and certain cancers sometimes don't show symptoms until they're pretty advanced. But before we dive in, make sure to hit subscribe for more health insights and leave us a comment down below telling us what oral health secrets you're eager to uncover. Let's get started. Warning signs you might ignore. When was the last time you thought about your toothbrush? Odds are, it's been a while unless you've recently needed to replace it due to worn bristles or an unpleasant smell. Well, there's more than aesthetics at play here. In fact, your toothbrush could be a silent hero, helping you catch warning signs of health issues you didn't even realize were brewing. Take gum bleeding, for instance. If you've noticed blood in your morning brush or on your toothbrush, it's crucial not to dismiss it as just a quirk of your oral hygiene routine. Instead, this could be your mouth waving a red flag about potential diabetes issues or gut problems. Yes, you heard right. Research has found intriguing links between gum bleeding and these conditions. A study published in the Journal of Clinical Periodontology in 2016, for example, showed that people with type 2 diabetes are more likely to experience chronic periodontitis, a severe form of gum disease, than those without diabetes. The American Dental Association also points out that gastrointestinal diseases like inflammatory bowel disease can increase the risk of both tooth decay and gum disease. So those tiny spots of blood aren't just an inconvenience. They're signals that your body's trying to tell you something. Similarly, tooth sensitivity can be a clue that you're grinding your teeth or have worn enamel. But did you know it can also hint at something as unexpected as acid reflux? A study in the Journal of General Dentistry in 2011 found correlations between tooth sensitivity and acid reflux, a condition where stomach acid flows back up into the esophagus. This can happen because the stomach acid is highly acidic and can erode tooth enamel over time. It's important to take such signs seriously. Untreated gum problems can lead to tooth loss, and uncontrolled diabetes can cause serious health complications. While tooth sensitivity can be a minor annoyance, it can also point to a bigger issue. The next time you reach for your toothbrush, pay close attention. Those little details could be the first step in staying on top of your health. Remember, it's not just about having pearly whites. It's about having a healthy smile that reflects a healthy you. So make an appointment with your dentist and doctor, and together you, LL, be able to decode the messages your body is sending you through your teeth and gums. The mouth-body connection. You may not realize it, but the health of your mouth is closely linked to the health of the rest of your body. What's happening in your mouth doesn't stay in your mouth. It can affect everything from your digestion to your heart health. Did you know that gum disease has been linked to heart disease? That's right. A study published in the Journal of the American Heart Association found that people with gum disease were more likely to have a heart attack or stroke. One reason for this connection is that bacteria from gum disease can enter your bloodstream and travel to your heart, causing inflammation and plaque buildup. Plaque is a major contributor to heart disease, so this could explain the link between gum disease and heart problems. But it's not just about what's inside your arteries. Gum disease can also affect your body's overall inflammation levels. Chronic inflammation is a risk factor for many diseases, including heart disease. People with gum disease tend to have higher levels of inflammatory markers in their blood, which could contribute to their risk of developing heart disease. So taking care of your mouth isn't just about keeping your teeth looking shiny. It's about protecting your heart and reducing your risk of other chronic diseases. The same goes for your digestive system. Research has shown that gut health plays a role in both oral health and overall well-being. Imbalances in your gut bacteria, also known as dysbiosis, have been associated with gum disease and other oral health issues. This is because your gut microbiome influences your immune system and its ability to fight off harmful bacteria in your mouth. By taking care of your gut, you're not only improving digestion, but also supporting your oral health. So remember, what happens in your mouth doesn't stay in your mouth. It affects your entire body. So make sure to take care of your oral health as part of your overall wellness routine. Dental clues to chronic illness. Ever wondered why your dentist seems to know so much about your general health? Well, it's not just small talk. Dentists often find themselves in the unique position of being the first to spot warning signs of chronic conditions that have nothing to do with your teeth. It's all about what they see and hear during routine checkups. Take, for example, the telltale signs of diabetes. A study in the Journal of the American Dental Association found that people with diabetes are at a higher risk of developing gum disease, and dentists are trained to spot the early signs of gum disease during regular dental exams. This means your dentist might be able to flag potential diabetes issues before they become major concerns. And it's not just diabetes. Research has revealed links between various chronic conditions and oral health. For instance, patients with undiagnosed HIV/AIDS may present with symptoms like lesions in their mouth, making a visit to the dentist a potential early detection opportunity. The American Dental Association also highlights that people with poorly controlled diabetes are at increased risk of oral health issues, making dental checkups a good time to discuss diabetes management. Even conditions like leukemia, a type of blood and bone marrow cancer, can manifest oral symptoms. So those seemingly routine dental visits are actually a valuable line of defense in spotting these chronic conditions. Your dentist is not just maintaining your smile, they're also acting as a gatekeeper to your overall health. So don't underestimate the power of a routine checkup. It could be the first step in managing a chronic condition you were uneven aware you were at risk for. What cavities, discoloration, and jaw pain really mean. If you're like most people, you probably visit the dentist when you absolutely have to, usually after a nasty cavity or painful toothache. But did you know that even seemingly minor dental issues can hint at something more significant brewing beneath the surface? Cavities, for instance, are not just a sign of poor dental hygiene or a sweet tooth. Research suggests that tooth decay might also be linked to nutritional deficiencies. A study in the Community Dental Health Journal found that low levels of calcium and vitamin D are associated with higher rates of tooth decay. This means that those nagging cavities could be your body's way of telling you that your diet lacks essential nutrients. Then there's tooth discoloration. Sure, it might be a cosmetic concern for some, but did you know it can also signal hormonal imbalances? According to a study in the Journal of Dentistry, women who experience significant hormonal changes, such as during pregnancy or menopause, may develop dental staining as a result. It's not just about what's on your teeth, it's about understanding what it could mean for your overall health. And let's not forget about jaw pain. The persistent ache you might dismiss as just tension could actually be a red flag for something more serious. A study in the Journal of Clinical Periodontology found a link between temporomandibular joint disorder, which causes jaw pain, and systemic diseases like rheumatoid arthritis and fibromyalgia. It's not just your jaw hurting. It could be your body's way of signaling an autoimmune issue. These dental clues are like secret messages, and your body's trying to get your attention. So don't ignore them. Take them seriously. Make an appointment with your dentist and doctor. By understanding what these signs mean, you're not just maintaining your oral health, you're safeguarding your overall well-being. So remember, every ache, stain, and cavity tells a story. Are you listening to what your mouth is trying to say? How to decode your own mouth? Now that you understand the connection between your mouth and the rest of your body, it's time to become a bit of a detective. Start by examining your toothbrush. Is there any unusual discoloration, or patterns, or an unpleasant smell? These could indicate underlying issues like diabetes or gut problems. Next, take a closer look at your teeth. Are there signs of sensitivity, cracks, or excessive wear? These could point to everything from tooth decay to acid reflux. And don't overlook your gums. Are they swollen, red, or bleeding? Such symptoms could signify not just gum disease, but also diabetes, heart disease, or even certain types of cancer. Finally, pay attention to your jaw. Any pain or discomfort could be linked to conditions like rheumatoid arthritis or fibromyalgia. These are just a few of the clues your mouth might offer. Each symptom is a piece of a puzzle that can lead you to a better understanding of your overall health. So don't ignore the whispers of your mouth. Learn to decipher them. It could be the key to a healthier, happier you. Healthy teeth, healthy life. When it comes to our bodies, we often compartmentalize, thinking that one problem is isolated to one part. But the truth is that our health is a tapestry, where each thread, whether it's our teeth, gums, heart, or gut, is interconnected with the others. Just like you wouldn't ignore a crack in your foundation, you shouldn't shrug at a cavity or bleeding gums. They're not just oral issues. They're signals that your body's trying to send you. So if your teeth could talk, would you listen? Because the secrets they hold could be vital to your health. From spotting chronic conditions to uncovering nutritional deficiencies, your mouth is a treasure trove of information. It's up to you to become a bit of a detective, to examine the clues your body presents, and take the necessary steps to address them. Don't wait for one part of your body to break down. Take care of the whole, because in the grand tapestry of your health, every thread matters. So make your oral health a priority, not just for a brighter smile, but for a healthier, happier life. And if you're ready to dive deeper into your body's secrets, make sure to subscribe for more insightful health tips. Together, we can unlock the mysteries of our bodies and pave the way for a healthier future.